General. We go now to Dr. Powlowski. Dr. Powlowski, please go ahead. 6 minutes.
Okay, Dr. Tam, I know hindsight's 2020, but let's look to the future now and basing decisions on science and evidence. And so I wanted to ask you about the possibility of some sort of mandated use of masks in Canada. Now, there is plenty of evidence out there, it seems, that masks are of benefit, mostly in benefit in preventing transmission from somebody who has the disease, perhaps people who are still asymptomatic and don't know they have the disease, transmitting it to other people. So there's a whole bunch of studies. Let me quickly just run over some of them. Howard et al. In a study that hasn't yet been published, but looks like it'll be published in Proceedings of National Academy of Science. They looked at the evidence and they concluded the preponderance of evidence indicates that mask wearing reduces the transmission per contact by reducing transmission of infected droplets in both laboratory and clinical contexts. The Annals of Internal Medicine, a recent meta-analysis, 64 studies, showed that transmission was decreased by 50 to 80% in healthcare settings. A Leung study on other forms of coronavirus showed decreased transmission when people who are infected have masks. There was a kind of a well-publicized light scattering study in New England Journal of Medicine showing when you had a mask and when you didn't have a mask. There's also been a number of papers written on modeling, looking at what happens when you add masks, even if they're not a solution, but add this incremental benefit combined with other public health measures can significantly reduce the transmission of disease in the progression of the pandemic. Many countries in Southeast Asia that have done very well in their response to the pandemic require masks in public settings, places like Taiwan, Singapore, Thailand. And I think 90 countries globally have some kind of mandated use of masks. And now to top it off, there was a recent letter in the open letter in the United States signed by 100 prominent medical people to governors across the United States. And the people who wrote this letter were a lot of people from Harvard, 2 Nobel laureates, people from Cambridge, Oxford, Berkeley, all the big schools. And their conclusion was that requiring fabric mask use in public places could be among the most powerful tools to stop the community spread of COVID-19. So they too are calling for mandated use of masks. Now we're spending billions and billions of dollars in dealing with this. It's really important we don't screw up as we come out of our initial social isolation. How about some form of mandated use of masks?
So, as I've just said, the Federal, Provincial, Territorial Special Advisory Committee, which includes the Chief Medical Officer of Health, have been reviewing the evidence, many of which you've just cited. And so they really wanted to ensure that there is flexibility according to their local context and local epidemiology. In provinces and territories where there hasn't been any community transmission, that's a bit different than, say, if you're in certain provinces where that has already occurred. So I think as we're exiting and beginning to cautiously and slowly relax some of the public health measures, we have updated our recommendation on the use of non-medical masks. And the way that it's positioned right now, based on the evidence, but also based on Canadian epidemiology, is that when the local epidemiology and the rate of community transmission warranted, the wearing of non-medical masks or cloth facial coverings is recommended for when you can't physically distance from others, particularly, as you can imagine, public transport, grocery stores, retail places. And it is a matter of, you're protecting others. So I protect you and you protect me is part of that. And so as to what exactly happens in the individual jurisdictions like Toronto or Montreal, they are needing to have the flexibility to do that. But it is, as you said, an added layer of protection as long as everybody remembers that doesn't necessarily negate the need for physical distancing and the hygienic measures. It is certainly an added layer when you can't be assured that you can get that 2-meter physical distance from others.
Okay, so
Dr. Powlowski, could you raise your mic a bit, please?
oh. So, Dr. Tam, I'm sure you would agree it would be wonderful if everybody in society did the right things, but that isn't the case. Would you be willing to consider the possibility of mandating the use of masks in places where there still is significant numbers of COVID-19 cases, like Montreal and Toronto?
So again, I think that's a jurisdictional flexibility, and I think as you will see, Montreal is increasing that kind of recommendation, but also you have to support people to be able to meet those recommendations. So ensuring that those, for example, who can't, we need to make sure it is available to all segments of society as well, and that. I think Canadians played a very, very big role in controlling this epidemic, and we must bring them together and their collective action. So the wearing of masks is a massive social behavioral change, and I do believe that momentum is now there. And so I think engaging Canadians and maintaining that trust is very important. Whether you're mandating it, then I think it depends on what happens in your local jurisdiction as to whether that is warranted.
Thank you, Dr. Powlowski. We go now to Ms.